This is Breastfeeding Basics, and my name is Laree Vickers. I'm the Perinatal Educator and Lactation Consultant for Coffee Regional. I'm so glad you've chosen to view this presentation because prenatal preparation is such a big factor in breastfeeding success. I hope you learn a lot, and I want you to reach out to me with any questions you may have. I will provide my contact information in the presentation. Please remember the information provided today is not intended to replace the advice of your doctor. In this introductory breastfeeding class, we will discuss the benefits of breastfeeding, how to set yourself up to meet your breastfeeding goals, how your body makes milk, breastfeeding during the first few days, benefits and technique for hand expression, breastfeeding positioning and how to get a good latch, management of some common discomforts of breastfeeding, helpful breastfeeding accessories, and pumping your breast milk. So there will always be mothers and babies who are unable to breastfeed, unfortunately. And there will also be mothers who just choose not to breastfeed. However, there is really no disputing the scientific evidence that breast milk is the best food for babies. Of course, this does not mean that you're not a good mother if you choose to feed your baby formula. Breastfeeding might not be the best choice for every situation, but these scientifically proven benefits cannot be overlooked, and I just want to mention them. Breastfeeding has countless benefits for your baby. These include, these are just a few of them: a lowered risk for SIDS, which is sudden infant death syndrome, protection from respiratory and gastrointestinal diseases, reduced occurrence of ear infections, decreased risk of obesity and type 1 diabetes later in childhood, decreased risk of childhood cancer, and protection against asthma and allergies. Breastfeeding also promotes bonding and contributes to your baby's emotional development. And there are also benefits for the mother who breastfeeds. These include a lowered risk of osteoporosis later in life, reduced risk of breast, uterine, endometrial, and ovarian cancer, decreased need for insulin with women with diabetes, lowered risk of type 2 diabetes, and reduced risk of heart disease. Breastfeeding also stimulates the release of the hormone oxytocin, which helps your uterus shrink back to its normal size and helps prevent excessive bleeding after birth. These are just some of the benefits of breastfeeding. Pregnancy is the perfect time to educate yourself on all things breastfeeding, but make sure to look to reputable sources for all of your information. There's so much out there nowadays that's accessible online. Some of it is good information, some of it's not good information. So just make sure that the information that you are looking at is credible. Learn as much as you can before your baby arrives so that you can make an educated decision on how to feed your baby and be prepared to reach your feeding goals, whatever they are. Identify your support system because you will need one. Who are your family or friends that have experience with breastfeeding? You need to know who your cheerleaders will be. And understand your why. Your reasons for choosing breastfeeding and your individual goals and expectations will be different from the next person's. If you choose breastfeeding for your baby, remember the reasons why you made that decision so that you can remind yourself if and when things get a little frustrating. And then be confident in your decision to breastfeed and in your ability to be successful. Lastly, you need to know where to go for help. You can reach out to me at Coffee Regional through phone or email. My contact information is here, and I'll be happy to assist you. There are also resources and lactation consultants affiliated with the Department of Public Health. Make sure you know how to access these resources when you need them. While you are getting ready to breastfeed by learning everything you can during pregnancy, your body is also doing some big work preparing to feed your baby. This is a fantastic video by Baby 360 that explains the process of milk production. The biggest things to remember are that during pregnancy, The hormones estrogen and progesterone begin the process of making milk. Soon after your baby is delivered, the hormones prolactin and oxytocin will drive the process of milk production. But breast stimulation and milk removal will be very important for developing and maintaining a good milk supply. Please click the link to view this short video. Breastfeeding can work for the vast majority of women and babies, but the process does come easier to some than it does for others. Many women have concerns about breast or nipple characteristics and how breastfeeding can be affected. I want you to know that breasts of all shapes and sizes can make milk, and breast size has very little to do with breastfeeding success. The size of the breast is largely determined by the amount of adipose tissue or fat content in your breast. So your milk producing and milk storage capabilities are not reflected by the size of your breasts. Big or small, you can be successful. There are some breast surgeries that can impact breastfeeding. So if you've ever had breast augmentation, a breast reduction, a biopsy, or even a cyst removal, or any other breast surgery, talk to your doctor or your lactation consultant about your risk for impaired breastfeeding. Also, nipples vary in shape and size. Some nipple shapes can make latch a little more difficult in the beginning, but with help, many women with flat or inverted nipples can still successfully breastfeed. If you have inverted nipples, you may want to reach out to a lactation consultant during pregnancy for assessment and advice on how to prepare for breastfeeding. One thing I hear regularly from mothers in our postpartum unit is, I don't think I have any milk. So I want to make sure that you know that you do have small amounts of colostrum or newborn milk available in your breast at the time of your baby's birth. Your colostrum is tailored to the needs of your baby. It's thick and almost like a yellow gel. The yellow color is due to the presence of beta-carotene, which is a byproduct of vitamin A, which provides immune protection for your baby. Colostrum is present for weeks before and several days after birth. It meets the nutritional needs of your baby, but even more importantly, it protects your baby from pathogens, which are bacteria and viruses that your baby will come into contact with. Colostrum has about 5 million living cells per milliliter. So to better explain this, 1 teaspoon is 5 milliliters. So 1/5 of 1 teaspoon contains 5 million white blood cells and antibodies to protect your new little baby and keep him or her healthy. Colostrum also contains good bacteria to crowd out the growth of dangerous bacteria in your baby's digestive system. It has specialized carbohydrates that are specific to human milk and cannot be replicated in formula, though formula companies have tried. These HMOs support your baby's immune system as well as brain development and cognition. Feeding your baby colostrum will make him or her healthier and smarter. Lastly, colostrum contains the perfect balance of protein to cause a laxative effect in the newborn, helping them to pass meconium, which is your baby's first stool. What you choose to do during the first hours and days after delivery will have a big impact on your long-term milk supply. Breastfeeding should be initiated during the first 1 to 2 hours after delivery. If your baby cannot go to the breast during this time, it's important to use hand expression or a breast pump to stimulate your breasts and remove colostrum for your baby. This colostrum can be fed to the baby by syringe or spoon. The average feeding during the first 24 hours after birth is 2 to 10 milliliters, or 1/2 teaspoon to 2 teaspoons. Your baby's tummy is the size of a marble on that first day, so he just needs small amounts of colostrum frequently. Babies are usually awake for about the first hour of life, and then they get very sleepy and take a long birthday nap. You'll probably need to undress and stimulate your baby to wake him for feeding during this time. Your baby should breastfeed at least 8 times during the first 24 hours and at least 8 to 12 times every day for the first few weeks, because breast milk is digested quickly and your baby's stomach is small. Also, your milk production will be maintained on a supply and demand basis. Empty breasts make more milk. Remember, your baby will likely cluster feed. Don't expect regularly spaced feedings. And don't try to skip over nighttime feeds. They are extra beneficial because your prolactin levels are the highest at night. Breastfeeding at night will give your milk supply a big boost. Skin to skin immediately after delivery has many benefits for your baby and yourself. Click the link to watch this short video on the benefits of skin to skin time. Hand expression is a technique that can be used to stimulate milk production and remove milk if your baby cannot go to the breast. You can use any clean container. I like to use medicine cups, usually in the hospital setting. Always make sure your hands are clean and you have your desired level of privacy. You can gently massage your breasts before beginning to help with milk flow. It's important to lean forward so that gravity will help the milk be guided where you want it to go. Some women have no interest in hand expression and others become very proficient in the technique and find it especially helpful in the first day or two. Because of the thick nature of colostrum, it's usually more easily expressed by hand than with a breast pump. The steps for performing hand expression are listed here. It does take some practice. The most important things to remember are to press in toward the chest wall before you compress the areola. Always make sure that your fingers are placed just along the edge of the areola so that you aren't compressing just the nipple. The milk ducts are positioned around the nipple along the areola. You can move your fingers to a different place around your breast after every few compressions or whenever the milk flow stops, so that you're making sure to compress all of your milk ducts. Scan the code to watch a video demonstrating hand expression. Another common question I hear from new mothers is, how often do I need to feed my baby? How will I know when she's hungry? With breastfeeding, it's very important to watch your baby for feeding cues and not focus so much on the clock. Don't wait until your baby's crying to feed her. Learn to recognize these early feeding cues and offer the breast when your baby will be most receptive to breastfeeding. Click the link to watch this video on feeding cues. One of the most important things I can teach you is how to know that your baby is getting enough milk. Since we don't visualize or measure the quantity of breast milk your baby removes from the breast, we need to discuss these indicators that can assure you that your baby is having his nutritional requirements met. First, it's important to let your baby decide how often and how long they want to breastfeed. Don't limit their time at the breast and aim for at least 8 to 12 feedings in every 24-hour period. This is a lot, but it's necessary. Second, work to make sure that your baby's latch is optimal. We will be talking more about this later in the presentation, but your baby's latch should be comfortable after the first few sucks. Their sucking should have a rhythmic pattern, and you should be able to see their ears wiggling when they suck. After about the third or fourth day, you should hear frequent swallowing. Your breast should also start to feel softer after feeding, and your baby should act satisfied. Diaper tracking is important for confirming your baby is getting enough milk. He should have at least one wet diaper and one dirty diaper for every day of age until he's 4 days old. After day 4, he needs to have several of each. And lastly, while all babies lose some weight in the beginning, your baby should begin gaining weight and be back to birth weight by 2 weeks of age. Click the link to watch a great video on how to know your baby is getting enough milk. After your baby is here, you'll need to experiment with different breastfeeding positions to find what works for you. The cross cradle hold, as shown in the third picture here, is my personal favorite for brand new moms. But many of our mothers also like to use the football hold, as shown in the second picture. Both of these positions allow you to support your baby and your breast, as you both learn this new skill. Regardless of how you choose to hold your baby for feeding, the basic principles are the same. Make sure you're comfortable. Use pillows to support your baby at the level of the breast. Always bring the baby to the breast. Don't lean or bend to the baby. And make sure your baby's nose is clear of breast tissue. We need your baby to be able to breathe through her nose while she's feeding. Click the link to watch this video on breastfeeding positions. Getting an optimal latch takes some work in the beginning, and it is more difficult for some moms and babies than for others. Just keep practicing. These are the steps to follow to make latch as easy as possible. Your baby's tummy should always face your tummy, and his head, neck, and shoulders should be in a line. It's really hard to swallow with your head turned to the side when you think about it. The baby's hips should be flexed and their knees bent so that the baby's body will just curve around you. Bring the baby to your breast with his nose at the level of your nipple. Baby's entire body should be close to you. Support your baby's neck, but don't put pressure on the back of his head. Let him tilt his head back and open his mouth very wide to take in the entire nipple and some of the areola. This is called a gape response. When the baby opens his mouth wide, roll your nipple into his mouth with your nipple pointed toward the roof of his mouth. This might take several tries at first, but don't get frustrated. When baby is latched onto the breast, his mouth should be open wide and his lips should be flanged out like a fish. His chin should be firmly tucked into your breast and his nose should be free or just lightly touching. Click the link to watch this video, which demonstrates and further explains how to achieve an optimal latch for breastfeeding. Even when you try your very hardest to do everything right, it's still common to experience some soreness and discomfort during the early days of breastfeeding. If you do feel pain while breastfeeding, it should only be for a few seconds. Nipple pain in the first days is usually caused by a shallow attachment. Your baby is probably not taking enough of the tissue around the nipple into her mouth. Occasionally, a baby may have a tight frenulum or a tongue tie, making latch more difficult, but the nurses and pediatricians will assess for this in the hospital. To prevent or manage nipple soreness, adjust your position and make sure your baby has a nice deep latch. Rotate positions. Don't use the same position every time so that your baby's mouth is not putting pressure on the same spots every feeding. Also, use short, more frequent feedings if you have nipple trauma. Use a nipple cream to keep nipples moisturized and prevent cracking. Dry nipples are more likely to crack and bleed. Many mothers also find it helpful to apply breast milk to their nipples, and you may find it comforting to use a cold compress immediately after feeding. Nipple pain after the first few weeks may have other causes. Contact your IBCLC if you develop new onset nipple pain after the early soreness has resolved. Engorgement of the breasts tends to occur during days 3 through 7 after birth, when your milk supply is being regulated and your body is trying to get rid of the excess body fluids that you carried during pregnancy. Frequent and efficient milk removal is the best remedy for this. You want to avoid long periods of time between milk removal, but also avoid excessive pumping, as this will stimulate even more milk production. You should aim for 8 to 12 feedings or pumping sessions in every 24-hour period. Warm compresses and hot showers are helpful for many mothers experiencing engorgement. You can also take over-the-counter ibuprofen for pain. Applying ice to the breasts after feeding is preferred over warmth by some women, and it may be helpful in decreasing swelling and inflammation in the breasts. Engorgement can sometimes cause your nipples to become flattened and make latch more difficult. If this occurs, it might be helpful to soften the areolar tissue before feeding or express a little bit of milk before attempting to latch. Normal engorgement should resolve within a few days. If it does not, reach out to your lactation consultant or your doctor. So there are no required accessories for successful breastfeeding, but there are some items that can make the experience easier and more pleasant for many mothers. So we will talk about some of the accessories that I think are the most likely to be beneficial. Most insurance providers will purchase an electric breast pump for expectant mothers. It's nice to have a breast pump on hand in case your baby can't go to the breast for a period of time. There are also lots of mothers who want to feed breast milk to their babies by bottle, and there's nothing wrong with that. Other mothers know that they'll be going back to work and they want to be able to supply milk for their babies when they're apart. And since your insurance will most likely cover it, you might as well take advantage and get yourself a nice breast pump. I want to encourage you to get a standard double electric breast pump that plugs into the wall. This type of pump will be much more efficient in removing milk and stimulating your milk supply than the fun, new, wearable, hands-free breast pumps. You may want to purchase a wearable pump, but you will most likely also need the standard old-fashioned one to get you started and make sure your breasts are being effectively emptied. You may order your breast pump through insurance at the website linked. If you haven't ordered your pump when you come to deliver your baby, we can most likely set you up with one from our supply closet. The Haka is a very inexpensive device which collects milk from the opposite breast during a feeding session. You simply latch your baby onto one breast and attach the Haka to the other breast. It works by suction to collect the milk that's released by your letdown reflex while you're nursing your baby. This milk would just drip into your nursing pad or onto your shirt otherwise. Some women absolutely love this device and can collect up to 2 ounces of milk per feeding for basically zero effort and no extra time. In my opinion, this is an accessory you should consider. In all honesty, I have a love-hate relationship with nipple shields. They can make breastfeeding easier and less painful in some situations. They can help in the case of flat or inverted nipples. They might help a baby with a tongue tie or a preterm baby achieve a better latch. And there are some situations in which breastfeeding just would not be possible without the temporary use of a nipple shield. So I am thankful for them in those situations. The problems with nipple shields are that they may affect milk production, and they can result in inadequate nutrition for the baby. So if you're using a nipple shield, make sure to do some additional nipple stimulation either by hand or with a breast pump to help support your milk supply. Use of a nipple shield can also hinder milk removal from the breast, which can cause engorgement, mastitis, or clogged milk ducts. So make sure your breast is being effectively emptied. It can also be very difficult to wean from a nipple shield, so try to wean as soon as possible. And these things are also a nuisance to have to keep clean and keep up with. Trust me, it is not much fun trying to search for a clear nipple shield in the middle of the night, in the dark, when you're half asleep and your baby is crying. Nipple creams can help keep your nipples moisturized and help prevent cracking. It's best to apply these immediately after feeding so that the cream can absorb before the next feeding. These products are not harmful to your baby, but some babies don't like the greasy texture of lanolin. Having a nursing pillow on hand during the first days after birth can be very helpful. It can be difficult to get comfortable and position your baby at the breast, especially in the hospital bed. You'll be breastfeeding very frequently, and you might be uncomfortable from delivery. So it'll be nice to not have to support the weight of your baby for the duration of the feedings. The boppy pillow is pictured here, and it's probably the least expensive option, and it works great. A good nursing bra will provide support to your breasts while allowing easy access for breastfeeding. There are different styles, so try a few and find the one that's the most comfortable for you. Nursing pads are worn inside the nursing bra and are used to absorb milk that leaks during your letdown reflex. Use of these pads will help prevent wet spots on your shirt. There are both disposable and reusable styles of nursing pads. If you plan to use a breast pump to collect breast milk, you'll need storage containers for your milk. There are bags, bottles, and syringes for colostrum that are available. Just make sure the container is specifically for breast milk. Pumping your breasts makes it possible for your baby to receive breast milk when going to the breast isn't an option. It also allows your baby to be fed by someone other than yourself, and it can help relieve engorgement when it's done appropriately. However, pumping is time-consuming and uncomfortable to some women, and it requires a lot of washing and sterilizing of pump parts to keep them clean and prevent bacterial growth. Mothers often ask me, when should I start pumping? And my answer is always the same. Start pumping whenever it makes sense for your unique situation. If your baby cannot go to the breast, you should start pumping or hand expressing milk within the first 2 hours after delivery, if possible. If you have concerns about developing and maintaining a good milk supply, you can begin pumping to provide extra stimulation in the first few days. But if your baby's nursing well and you don't need to have milk available for bottles, you don't have to pump. It can be hard to find time to pump during the first few weeks due to the frequent newborn feeding sessions. If you're needing to build a supply of milk for your freezer, start pumping about 3 weeks before returning to work or school, and try to have enough milk on hand for about 3 days of feeding. But if you can only be 1 day ahead, that's good enough. If your baby does not go to the breast and you are exclusively pumping to provide milk for your baby, you should pump on a schedule that mimics your baby's feeding schedule. Pump every 2 to 3 hours during the day. You might be able to space out your nighttime pumping sessions a little bit more. If your baby mostly goes to the breast, you can just pump to meet your individual needs. Make sure to pump for at least 20 minutes each session. Some women might need to pump for 30 minutes to effectively empty their breasts and get the desired amount of milk. Pump until the milk flow slows way down and your breasts feel relieved. And remember, your breast is never completely empty. It's important to make sure your flange size is appropriate for your nipples. The standard 24 millimeter flange is too large for most women. If you feel discomfort or have difficulty emptying your breasts with the pump, consider a smaller flange. Measure your nipple to make sure that you get the correct size. You can also lubricate the flange with nipple cream or flange lubricant to make pumping more effective and comfortable. Always clean the flange and other pump parts that come into contact with milk after each pumping session. Pump in a quiet spot where you can be comfortable, and don't start with the highest suction setting. Start low and increase to the highest comfortable setting. Pumping should not hurt. You may store your freshly pumped breast milk at room temperature for up to 4 hours, or in the fridge for up to 4 days. Frozen milk is best used within 6 months, but may be used for up to 1 year. Frozen milk that has been thawed may be kept at room temperature for 1 to 2 hours or in the fridge for up to 1 day. Never refreeze milk once it's been thawed. Any milk left over in a bottle after feeding should be used within 2 hours. And remember to never thaw milk in the microwave. Use warm water or a bottle warmer. Click the link to watch this video on how to keep your pump clean. We have covered a lot of information, and there is no way that you can remember everything we've discussed. Here are the main things I want you to recall. You will have colostrum present and available in your breasts when your baby's born. You'll need to be prepared to nurse your baby very frequently during the first weeks. Remember, 8 to 12 times in every 24-hour period is optimal. Milk supply works by supply and demand, so you will need to frequently remove milk in order to continue making milk. Remember to observe for your baby's feeding cues and expect cluster feeding. Don't try to force your baby into a strict feeding schedule. Your baby will sleep a lot in the first days, and you'll probably need to wake him up to feed. And lastly, it may be a little challenging in the beginning to get a good, comfortable latch. Be patient and persistent, and don't give up. Thanks for joining me today. Please reach out if you have any questions or need help with a breastfeeding-related issue. I would love to hear from you.